episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Groups. Today we are going to venture into the very interesting topic from the perspective of what are known as unrepresented nations and peoples, defined as sort of unrecognized, self-declared autonomous states. As a little background, in 1991, in the area to the northwest of Somalia, a country which had no functioning central government and ongoing civil war, the area declared an independent state of Somaliland, officially named the Republic of Somaliland. Somaliland currently lies in northwestern Somalia on the northern coast of the Gulf of Aden. It's bordered to the east by the Plain of Somalia, Djibouti to the northwest, and Ethiopia to the south and west. Against many odds, this area established a system of democratic governance and a very ambitious national development plan. The central government has informal ties with some formal governments. Delegations are sent to Hargeisa, which is the capital. Ethiopia has a trade office in the region. However, being a young state or a young undeclared state, its independence in many ways is still unrecognized by other organizations and countries. Somaliland is defined as a post-conflict state whose systems still remain fragile and vulnerable to many outside influences, including the healthcare system, especially when trying to develop a system from the ground up. Today, I'm really happy that we are joined by Dr. Mohamed Mosa Hassan, who is chairman of the Somaliland Medical Association. He is also medical activity manager for Médecins Sans Frontières, Doctors Without Borders International, president of the Somaliland Hypertension Society. And he's joining us to discuss the various challenges of establishing a healthcare system for a so-called unrecognized territory. Dr. Hassan is also involved in the Global Fund for Tuberculosis. He worked for the Ministry of Health for the government of Somaliland. He was consultant at the Army Health Services and is also working with Save the Children International. Additionally to all that he's involved in on the healthcare front, he is also the CEO and founder of YMAX Care, which is a very innovative e-health company. Dr. Hassan, thank you for taking the time out of your schedule to come on the show today.
Thank you very much for inviting me to the show.
Absolutely, it's our pleasure having you. I actually want to start off by giving you the floor to talk about you and introduce yourself, sort of your background, where you grew up, how you got involved in medicine, and ultimately how you've really taken on this central role in building the healthcare system in Somaliland from the ground up.
Yes, and my name is Dr. Mohamed Mosa Hassan, and I was the first medical student who graduated in University of Hargeisa in 2009. And for the last 10 years, I have been working in the health sector of Somaliland and also in the health sector of Africa in general, in Nigeria and Sudan. And I am, as you told now, the chairman of Somaliland Medical Association for the last 3 months. And my previous role was I was MSF International Staff, MSF Spain, and I was medical activity manager in Nigeria and Sudan. And in the health sector of Somaliland, I have been working in the TB sector for the Global Fund program. Also, I have been working Save the Children International, GIZ, which is International Development Organization of Germany. I have also worked experience with GED of German Emergency Directories. And on top of that, I am the founder of also of and also some health. They are private healthcare companies importing products outside the country, especially importing quality products in Somaliland. And so that's my brief introduction for the last 10 years, and I'm very happy to be the show. And thank you very much for inviting me.
Definitely. No, we really appreciate you taking the time to join us. Could you for sort of the United States audience and folks watching in Europe. Could you just talk a little bit about the existing system? Because Somaliland, it's not like there's no healthcare system. You have hospitals, you have TB centers, you have various maternal child health clinics, but still a shortage of personnel and obviously underinvestment. Talk a little bit about what the system is like today and what some of the critical elements are that you are focusing on in building it up.
So for the last 28 years, since Somaliland became independent from the rest of Somalia, the country is working on re-establishing the system of healthcare system. Despite the efforts that we input the national healthcare system, in general, Somaliland, we use what we call essential package of health services, EPHS, which is a system that the international community and Somaliland Ministry of Health developed to be in a platform of developing the healthcare system in Somaliland. So the EPHS system, we have a system of healthcare facilities in 4 levels. We have primary healthcare unit, we have health center, we have referral health center, and we have referral hospital. And from all these levels are providing and in Somaliland, what we focus is the health center level, which is the primary health care, which we provide maternal and child health services mainly, as well as TB, malaria, and HIV. And in Somaliland, most of the healthcare financing is from the international community. Government Somaliland now contributes 6% of this national budget into the.
You talk about that a little more, because I know that you've been instrumental, obviously when you cannot have some of the international recognition from certain countries, but you've been very instrumental in bringing international organizations to Somaliland to, as you were mentioning, help with the financing and the development. Talk a little bit about some of that you've been involved in as well. And some of I think the government of Norway at some point was involved with some programs, correct me if I'm wrong, but talk a little bit about your activities there, if you would.
So in Somaliland Medical Association, provide capacity building with our members and providing the capacity care with our members to increase the quality of healthcare services in Somaliland. Because Somaliland Medical Association is responsible with all Somaliland medical lecturers in Somaliland, and also we provide healthcare services in the community as volunteers. So we are now establishing a system of care delivery in outreach and health reach communities in Somaliland, and that we mission is what we provide is we provide basic healthcare services. We have also a program of increasing immunization coverage of children under 5 years, which is supported by UNICEF in Somaliland. And through our program, what increase coverage of national immunization program in private sector, while the government focuses on the public sector. So that is basically we do in Somaliland Medical Association.
Excellent. You are also the, as mentioned earlier, you're also the head of the hypertensive Society of Somaliland. And, I think obviously hypertension, cardiovascular disease, major killers all around the world. Talk about sort of some of the, you talked about sort of child mortality, immunization, things of early life. Talk about some of the chronic disease issues that you also have to contend with in the region that we might not normally think about, like hypertension on the continent of Africa.
Yes, so in general, because all our healthcare financing is mainly focused in communicable diseases and malnutrition in Somaliland. there is a huge need to focus on non-communicable diseases, including diabetes and hypertension. So the key problem now in Somaliland is that we need also to focus on non-communicable diseases, diabetes, hypertension, and also cancers. And what we do in Somaliland Hypertension Society is, and also we do screening every May of every year. There is a May measurement month, an international initiative which is to increase the screening of hypertension screening and detection. So we collaborate with International Hypertension Society. What we do is we screen people in Somaliland about hypertension, and they support us providing sphygmomanometers and also some awareness material. So hypertension is very high, despite being very high. Very low. We have a very low contribution of the international community on focusing on non-communicable diseases, and many people are struggling with getting the medicines, access to medicines, because the medicines are very, very high price.
Sure.
Sometimes are not available. And so that is what we do in Somaliland Hypertension Society to prevent.
Wonderful, wonderful. You were, as mentioned, you were also aside from all the health system activities, you also are an entrepreneur. You run a company called WIMAX, which is associated with eHealth, and these mobile health technologies, whether smartphones, telemedicine, medical drones, things like this, are really in many ways going to offer a lot of disruptive solutions around the world, but you would think, especially in Africa, Somaliland, where there might not be all the traditional infrastructure and sort of the access is limited. Talk a little bit about what you're doing at WIMAX and sort of the importance of such health technologies for access across the region, and bringing in or being able to access more patients using these new technologies on the ground.
Yes, what we do is we established what we call Talo Doctor, which is in Somali free healthcare consultation is online in the Facebook. So what we provide is we pick up a topic and then we provide that topic in Somali with our Facebook followers, and they can also message us and also ask us through SMS and WhatsApp. So is that despite the high challenge of basic infrastructure, we think technology can cover some gap of because we don't have enough human resource. Sometimes we don't have enough specialists in Somaliland. What we do is we link people in the voluntary specialists worldwide to provide consultation. And so what we are thinking about is linking technology into the healthcare. That is exactly what we do, what we are trying to do, and we are working on that.
Excellent. Excellent. Well, I really appreciate you taking the time to come on the show and share what is really a complex and set of things that you're doing in what can only be defined as sort of building a system from the ground up. It's truly inspiring, and I take my hat off to you and really thank you for everything you're doing and sort of bridging the gap between necessary healthcare services.
What I would also like,
please.
What I would also like to add is, as you mentioned, Somaliland is in one of despite the region which is high instability, we manage to have our own system, our own government, peace and prosperity. So one of the complications of unrecognized state is that there is no healthy investment.
Mm-hmm. Well, you're doing quite a lot with the limited investment that comes in. It's remarkable.
Yes. So what we would like is that international companies also support the healthcare system. I mean the private sector, because private is very important in the healthcare development of any country. And I would love to welcome any international company, if they are pharmacological companies or any other healthcare companies or technology-based companies, to come and assist the country, because it is potential area that needs to be supported and also provide the services that people need.
Outstanding.
So yeah.
Hopefully, we will help you. We will help you spread the word about that. It's extremely important, and thank you for adding that. Once again, for everybody that's going to be watching this episode or listening to the various podcast networks, we've been lucky to be joined by Dr. Mohamed Mosa Hassan, who's chairman of the Somaliland Medical Association, medical activity manager, Doctor Without Borders, president of the Somaliland Hypertensive Society, and CEO of WIMAX Care, doing truly amazing things in Somaliland and building up a healthcare system from scratch, in essence. Spread the word about this amazing doctor and everything that's going on. Share your knowledge, and if there's anything else you want to say while you have the floor now, please. I'll give you the rest of the show.
And I would like here to thank you for giving us the time to speak out and spread our word internationally, and also encouraging us doing this remarkable saving in both private and public sector. And Somaliland Military Association would like to thank you for your time and interview.
Thank you so much for joining us, Dr. Hassan.